Okay, good morning. Thank you all for participating in today's media briefing. This is our 26th since the start of the pandemic. These press conferences are a reflection of UPMC's ongoing commitments to provide timely and accurate information for all. Today I'm joined by Tammy Minier, UPMC's Chief Quality Officer, Dr. David Nace, Chief Medical Officer for UPMC Senior Communities, and Dr. Don Yealy, UPMC's Senior Medical Director and Chair of Emergency Medicine. They will provide an update on UPMC's COVID-19 vaccination of frontline healthcare workers and nursing home residents, explain how UPMC has also extended COVID-19 vaccinations to non-affiliated frontline healthcare workers, and share our latest data on COVID-19 clinical outcomes. After their remarks, we will take your questions. Tammy.
Thank you, Paul. I am very proud to share that since December 14th, in just 4 weeks, UPMC has distributed 41,700 first dose COVID-19 vaccines to our frontline healthcare workers. This represents well over half of our clinical facing staff. We are now vaccinating thousands of employees every day. We expect to have the frontline staff who want the vaccine inoculated by the end of January and have already begun administering the second dose to the earliest recipients. Nearly 9,000 of our staff have received their second dose as of this morning. We are also very proud that nearly 80% of our frontline workers who have been contacted have indicated a willingness to get the shot, higher than what we saw with the flu vaccine program before we universally required that. To these colleagues, thank you. Thank you so much. When a job needs doing, we roll up our sleeves and get it done. In this case, literally by rolling up our sleeves. Those we've vaccinated to date have seen the typical side effects: sore arms, some fatigue, muscle aches, but this is a safe and effective vaccine. In addition to vaccinating our own staff and many nursing home residents, our teams have worked around the clock since the New Year's holiday weekend, and we have built a system to share vaccines with our non-UPMC frontline healthcare workers in our communities. Even before the state required health systems to allocate 10% of their vaccines, UPMC had already vaccinated thousands of EMS and non-employed healthcare workers who care for our patients in our hospitals. As of this morning, that represents 2,300 individuals who have been vaccinated. We have very aggressive region-by-region plans launching this week to share vaccines with additional EMS, police, fire, and other key frontline personnel. We're prioritizing non-UPMC frontline healthcare workers who serve under-resourced communities so that this limited vaccine can make the biggest impact in those areas. UPMC has proven to be a very effective distributor of the COVID-19 vaccines. As we complete the vaccination of our staff, our nursing home residents, we look forward to a closer partnership with the state and county officials to make sure that on a region-by-region basis, we can offer vaccination to as many people as possible. Dr. David Nace is now going to update you on another vulnerable population, residents of skilled nursing facilities who we've been vaccinating. David?
Thank you, Tammy. I'm going to briefly update you on 3 of our long-term care efforts. With regards to vaccinations, we started administering the Moderna vaccine to employees and residents of UPMC senior communities on December 29th. As of Monday this week, we've administered just over 1,300 vaccines to roughly 830 of our healthcare workers and about 475 of our long-term care residents. It's about half of our skilled nursing facility residents. So far, we provided vaccines to 17 out of the 27 skilled nursing, personal care, and assisted living facilities through our long-term care pharmacy. And similar to the exceptionally high acceptance rates that we've seen in our hospital population, about 75 to 80% of our nursing home staff and residents who have been offered the vaccine and have been eligible have replied to the vaccination. Beyond our own facilities, as of December 31st, UPMC is part of the Regional Congregate Care Assistant Teams, RCAT, The RCAT team replaces the federally supported Regional Response Health Collaborative, or RIC program, which ended in December. The state program, RCAT, continues to leverage the expertise of certain health systems to help long-term care facilities throughout the Commonwealth that are struggling with COVID-19 outbreaks. Through RCAT, UPMC is leading efforts to make sure healthcare workers and residents in facilities regionally are safe and supported. In addition to the vaccinations and to our care leadership, UPMC has also begun to administer a promising COVID-19 therapy in our facilities, monoclonal antibodies, that others are struggling to administer to vulnerable populations across the country. Dr. Donald Yealy will now tell you more about that and other efforts to continue improving our clinical care.
Thank you, Dr. Nace. As Dr. Nace said, vaccines are not the only tool in our arsenal. We've been highly effective in making monoclonal antibodies available to the right patients at the right time, and that's before they are sick enough to need hospital care. These medications are IV infusions. They're produced by Regeneron and Eli Lilly, and they're currently available under an emergency use authorization. They're used in non-hospitalized people who are vulnerable to the complications of COVID-19 illness and infection. If given early in their illness, this medication can help keep these people out of the hospital. And unlike some of the stumbles that we've seen at other medical centers around the country, UPMC is delivering its doses through a highly coordinated system to each patient who qualifies, even bringing IV infusions of the medication to the patient, in addition to using safe and accessible infusion centers. All of this is an effort to keep them from ever needing hospitalization and to help people recover. UPMC continues research on its own improved version of antibody therapy, one that may aid not only COVID-19 care, but could be a future model for infections. At the other extreme, with the very sickest of the COVID-19 patients, those who are requiring or heading to requiring a breathing machine for assistance, we continue to learn from our clinical experience and add to the knowledge by doing groundbreaking research. The data that we've gathered, particularly over the past 3 months, helps us counsel patients and their families as they choose care. The death rate in the hospital for COVID-19 patients who are 70 years or older and who require a breathing machine, that is people who are so ill that they've failed all other support approaches, is very high at 75%. This is consistent with what we hear from our colleagues around the country. We know this, and we are active in trying to do the best care to avoid that particular set of circumstances. But given the very large numbers of people infected, we have sadly seen more in-hospital deaths. Let me just emphasize, fewer and fewer people proportionately end up needing breathing machines. I share this not to cause fear, but to help the families of patients understand that when you reach that point, they understand what the prognosis is for recovery and make the best decisions. Compared to the spring, overall COVID-19 outcomes are improved, likely because standardization around evidence-based care, including the use of steroids and other medications that help change the immune response, pioneered here through the novel UPMC REMAP adaptive platform trials that we've discussed before. The proportion of patients seen in our emergency departments who are admitted for hospital care fell by 25% compared to the spring. And the percentage of COVID patients who were started on a breathing machine also dropped by 10%. The death rate for people who were never placed on a breathing machine for COVID-19 illness is 9%. That's in sharp contrast to the 65% death rate in the hospital for those who require a breathing machine. These observations are not only consistent across all of our UPMC sites, but with other sites around the country. So overall, in a relative sense, the outcomes are improved and are good news, but we still have the pandemic here with us and in high numbers. I don't share these numbers to downplay anything. COVID-19 poses very serious risks for many people, especially the elderly and those with underlying conditions. Any of our frontline nurses, doctors, and other clinicians will tell you this disease is deadly. While we have a vaccine, it is in limited supply right now, and we're currently targeting healthcare workers and those in skilled care facilities. Our public health and governmental partners are still working through directions and plans for use of the vaccine in the general public. Right now, the most effective way for you to protect yourself and to protect others is to wear a mask that covers your nose and your mouth, to practice physical distancing and avoid congregations outside of your immediate family, and to use rigorous hand washing. These simple steps are your vaccine. We know these work, and these are the measures that work.
Thank you all. And now we'll take questions from the media, all of whom are joining us remotely online. To ask a question, you'll have to go to the participants icon at the bottom of the page and press the Raise Your Hand button. That will put you in the queue. I will read your name and your line will be unmuted for you to ask your question. Please be sure to unmute the microphone on your end. We will try to call on as many different media outlets as we can in the time that we have allotted. First question I have is emailed to me. Tammy, Don, this is probably for both of you. Mm-hmm. Why has UPMC been able to distribute vaccines seemingly much more quickly than others? And how can UPMC help speed up the distribution to the entire communities that we serve?
Well, that's a great question. So I thank you for asking it. You know, as we mentioned, we have been rolling this out across the state in all of our regions really for the last 4 weeks. And as always, our incredible workforce of individuals and our amazing IT infrastructure have allowed us to expedite and leverage those systems to smoothly and effectively get the job done. We are leaders in each of those spaces, along with having built some amazing operational processes and are really positioned, I think, beautifully to keep moving faster. We are ready to work through the rest of the populations that are out there and feel very confident that we can get the job done through that. Don, what would you add?
I think one of the other things that UPMC does very well is learn from doing. We told you at a previous press conference that we used the influenza vaccination season in the fall to learn how to more quickly deliver vaccines. And we use that learning to begin the process with COVID-19 vaccinations. COVID-19 vaccinations have been with us less than a full month, and each day and each week we get much more efficient and we can do more people quickly and safely. We will continue that activity as vaccination begins to move away from just healthcare workers into others.
Okay, next question comes from Paul Goff at the Pittsburgh Business Times. Paul, please go ahead.
Hi, thanks to all of you for taking the time. The Trump and the Biden administrations have just announced that they're going to distribute all the vaccines immediately, not reserving a second dose. And then also, I think, even prioritizing people over 65. It's sort of late-breaking news. Can you tell me how that will impact both UPMC's effort and also the overall vaccine effort?
Well, Paul, thanks for such a great question. Also, we are frankly thrilled and very supportive to hear of the decision at a federal level to see vaccine distribution accelerated. We do believe that we have the systems and processes in place to take that vaccine and get it in the arms of the right patients and the right people in our community. So we are anxious to learn more. This was an announcement just prior, as I understand, to us being in the press conference right now. stand ready to receive and stand ready to move forward, and are very confident that we can continue to be a leader in assuring our communities are as protected as possible from the vaccine that we have in front of us. Any additional comments any of my colleagues want to
David,
add?
you want-
Yeah, Paul, as you know, UPMC for weeks to months now has been in active dialogue with the government, both the Commonwealth and the federal government, trying to get as much vaccine as possible, recognizing the important contribution. We look forward to having even more opportunity given this late breaking news. We can get vaccination into people's arms once we get the vaccine to us. We recognize that it'll be a partnership. Our intellectual abilities, our people, our delivery approaches, together with what's available in the region from other providers and from the government. This is a big undertaking. This is the D-Day of vaccination. We're trying to get tens of millions, hundreds of millions of people vaccinated, and it's going to take smarts and cooperation. We stand ready to do that.
Next question, Chandy Chapman, WTAE TV. Chandy, please go ahead.
Thank you. I was wondering what type of training goes behind administering the vaccine if a person doesn't have any type of background in healthcare? What type of people are administering these vaccines in that case? Second part to my question, are you distributing the vaccine to municipalities or essential workers like police and fire? I remember in the beginning you mentioned briefly about police and fire.
So the state has provided some ongoing guidance about who's able to provide an injection, and that has been opened up. We greatly appreciate that, to allowing pharmacy students and nursing students who have had the appropriate training to do that. So just about many of our employees on the front line are capable of providing injections, and we've been very fortunate. So many people want to volunteer and help to make this happen. So I am very appreciative of the additional, I will say, lightening of the rules to make this a little more expeditious. The second part of your question is that actually administering this vaccine requires a high degree of coordination, particularly starting with the sub-zero storage requirements that many of our municipalities and our local communities settings and frankly, our physician offices do not have access to that. In addition, the infrastructure requirements of reporting who the vaccine has gone to are quite large, as you would guess. So we have not disseminated any vaccine to other providers in the region. We are actually providing it to them ourselves through our own infrastructure, through our own teams, to make sure that we know it's done safely and well. And we'll continue to do that and accelerate that across the regions as we're provided more vaccine.
Next question, Sarah Bowden, WESA FM. Sarah, please go ahead.
Hi, thanks so much for taking my question. So based on reporting by myself and my colleagues, UPMC, to its credit, is vaccinating staff at, like all staff at hospitals. It doesn't matter the role, which really makes sense from an infection prevention standpoint. But I'm also hearing from multiple sources that employees at UPMC who do not work within medical facilities, some of whom work from home, have been doing so since the start of the pandemic, are getting vaccinated as well. I'm talking about people in departments like fundraising, communications, insurance services, as well as admins who work remotely. So my question is, when, as Tammy Minier noted, the vaccine is so limited, why is UPMC inoculating these individuals since they arguably do not fall into the 1A category?
So again, another great question. So early on, the guidance and direction that we've been provided by the state and the federal officials were focused on vaccinating employees within health systems and hospitals. And if you were to take the approach that we've taken with the prioritization and look at many other organizations across the United States and here in Pennsylvania, we are following those same guidelines and feel very confident that we are meeting the intent of all of those regulations. We have been fortunate to have some of our sites through the distribution process, receive an allocation that has allowed us to work through our prioritization groups. And we will continue to do that as we now begin to more aggressively vaccinate folks that are outside of UPMC in the 1A category. Don, would you want to add anything on that?
Yeah, I think it's important to point out we're trying to serve a couple of goals here. One is to make sure that key healthcare workers are immunized as quickly as possible so that anyone who needs care can continue to have that care. And secondly, to make sure that we're a part of a much broader vaccination process. We prioritize, we schedule, we plan, but we make sure we do not ever fail to use as optimally as possible vaccine that's ready. So in a given narrow period of time, when we vaccinated people at the highest level, we take the next priority group. The people you're talking about are not folks who would never get a vaccine and would never be considered even in one of the other earlier phases. They're in a prioritization sequence, and we want to maximize our efficiency. We think this meets not only the guidelines by the Commonwealth, but good common practical sense.
Next question, Danny Fitzgerald, Beaver County Times. Danny, please go ahead.
Great, thank you so much. Question for Dr. Yealy. Going back to the monoclonal antibodies, I know you've went over this many different times, but just to clarify again, since the idea is to administer these so that people don't have to end up getting severe care and a severe case of COVID-19, can you just reiterate, if someone were to think they have COVID, maybe they don't have a severe case, is this something they can go to their doctor about? Is this something that they have to get diagnosed with COVID and then through the process they can receive these antibodies, or how does that process work?
That's a great question, and thanks for asking it. Monoclonal antibodies are intended for people who have symptoms of COVID, have a clear positive test, and we use the PCR test. We've talked about the two different types of tests that are available, the better test. And they also haven't been sick for an extended period of time and generally fall into a couple categories, either based on your age or your overall weight. Those are the people who benefit the most from monoclonal antibody therapy. There are some other categories also. The first step is to see your doctor, your healthcare provider, whether it's a physician assistant or a CRNP, and be diagnosed with COVID-19. And next is for them to request monoclonal antibody therapy. We're lucky enough here in Western Pennsylvania that we have enough supply that we haven't had to use any other means of distribution like a lottery yet, although we have that available. We want people to be able to benefit from this. So the key things are right people, early enough in their disease, and diagnosed. We've given over 330 courses of therapy right now, much more than not only anyone in the region, but many other similar areas around the country.
And just to add to that, we've used monoclonal antibodies in our long-term care facilities. We actually go out whenever there's a case within a facility or an outbreak within a facility, and we try to identify those individuals that would meet those criteria and push that therapy forward for them so that they have it available. So it's active case seeking to make sure we get it to the right individuals.
Great. Next question, Mark Goshgarian of Spectrum News in Buffalo, New York. Mark, please go ahead. Mark, please unmute on your end.
Yep. Can you hear me?
We can hear you now.
Okay, great. Yeah, I also wanted to follow up on that a little bit too. And you just answered my question about the antibodies, but working and covering UPMC Chautauqua in Jamestown, Dr. Yealy, how significant is this testing for rural areas, especially in Chautauqua County, Jamestown, where you do have that older population and more rural areas? How significant is that to these folks, and why?
Well, testing is important, particularly if you're thinking about some of these very specific interventions, monoclonal antibodies. One of the things we're most proud of is how UPMC Chautauqua has been able to meet the testing capabilities with the highest level of testing available through the help of our central laboratory facilities. We're able to diagnose it quickly and then get people on the right pathway, whether it's hospitalization, monoclonal antibody therapy, or just observation. So I think you're right. I think it's true in almost any location, whether we're talking rural or very urban, that testing promptly with a good test that performs well matters a lot.
Okay. Next question, Mick Stinelli from the Pittsburgh Post-Gazette. Mick, please go ahead. Mick, please unmute on your end.
Sorry, I went a little early there. In addition to the federal government saying they're ready to move forward with other people to vaccinate, like older people, people with underlying conditions. Yesterday, Dr. Levine said that they expected to move to phase 1B soon. Not really any specifics, but she said soon a couple of times. I was just wondering if UPMC is prepared to distribute to those groups of people. Is there enough vaccine available to start giving it to all those people without, shorting the staff?
We are absolutely prepared to administer those vaccines. What we need is the vaccine. So the secretary, in sharing that announcement, which was tremendous, we are looking forward to additional information from our state offices on when we may receive and have that vaccine in hand. And as soon as we do, we will be ready to go forward in vaccinating those additional individuals in that 1B grouping.
Next question from Grace Griffithton at WPMT TV in York, Pennsylvania. Grace, please go ahead.
Hi. Thank you sorry about that. Technology.
Try that again, Grace.
Thank you guys for having us. We have spoken with first responders throughout this vaccination process, and some of them had reported, just having to drive a little bit to get the vaccine, like some providers over an hour. Just wondering if that situation has improved at all, and if this was something that you guys were aware of.
Can you restate that very quickly, Grace? You were breaking up. Grace, please restate your question. You were breaking up. Let's go to the next person, Megan Guza, the Tribune Review, and Grace, please try to get back in. We'll try to get back to you. Megan, please go ahead.
Hi, thanks so much for taking the time today. This was talked a little bit about earlier. I just wanted to see, I know UPMC has a really robust volunteer program. I wanted to see where the unpaid volunteers are in line in terms of the vaccine, particularly those who are still working within the hospitals, directing people, checking temperatures, that type of thing.
So we included our unpaid volunteers that were at the bedside with our other 1A group individuals. And so they have been appropriately prioritized with our staff and providing care and vaccinated.
Thank you. Next question, Nicole Brambilla from the Lancaster Online. Nicole, please go ahead.
Thank you so much for taking my question. I have two that are related, and it's a follow-up to press a little bit more on a question that somebody else asked previously. When specifically did you start vaccinating non-frontline workers, and why, given how scarce the vaccine is? Tammy, you just said, you're prepared to vaccinate, but what you need is the vaccine. If you're vaccinating people who are in billing or who are in other jobs that wouldn't even come in contact, they're working remotely and such, why vaccinate those and not save it to those that are really dire? And Dr. Neese, you and I spoke about this earlier, about the nursing homes and those that are 75 and older.
That's a great question, and one that continues, as you know, across the United States to prompt a lot of dialogue. So one of the things that we learned early on is that you really can't categorize a group of employees just by job title. You actually have to understand their work. And to exemplify that, I'd like to give you an example of an IT employee. So folks would immediately look at an IT employee and say, well, they don't interact with patients. That's not true. IT employees at UPMC are present throughout our hospitals. They interact with our clinicians side by side, placing our clinicians at risk, and are equivalent contributors to the healthcare community. Healthcare communities are more than just the individuals, and so we, through our guidance with the state and our own internal prioritization and our expert group, feel very confident that we've made the right decisions in how we've prioritized folks.
And I think that's, what we see in long-term care is also very similar. Every single person that works in a long-term care environment contacts a patient at some point, whether you're maintenance, dietary, housekeeping, or the person that's a receptionist or a nurse. So every single person, and what we look at in terms of the prioritization of those individuals is the degree of that contact, but every single person meets a patient at some point in our long-term care facilities.
I think one other thing that needs to be emphasized is the goal of the vaccine was not to make the work environment safer because that person was vaccinated. It really is to begin the process, number one, of ensuring the healthcare system can continue to provide. Most people who are healthcare workers who have an exposure or develop illness, it happened outside of the clinical setting, not inside the clinical setting. And so therefore, making sure that we vaccinated people who are healthcare workers in whatever priority are is an important goal to make sure the system still works for everyone. We think that we kept people very well protected for the past 10 months, given our plans and our PPE. We've had virtually very few people develop any symptoms or positive COVID illness, and no one who's been a healthcare worker who required intensive care because of infection that they got in clinical work. And I think that's a common misconception about why the vaccination rollout started. It's to make sure that initially the entire healthcare workforce still can do the things that are important.
Okay, let's try Grace Griffithton again at WPMT TV in York. Grace, let's try you again.
All right, fingers crossed this works. Can you hear me?
So far, so good.
Okay. I had done a few stories with some of those providers you guys had mentioned earlier, those non-affiliated providers who had said that when they went to get their vaccines, they were just having difficulty finding close locations, like some of them saying they had to drive over an hour. And I was just wondering if that is something that has been refined or an issue that you guys were aware of, and just how it'll go moving forward.
So we absolutely have done our very best to minimize the amount of travel that individuals have to do to get the vaccine. There were a couple locations added in the last few weeks in our Harrisburg region to be able to provide that accommodation going forward. And so I think we've addressed it.
Another thing that's important to point out is the two vaccines that are available now, in particular the Pfizer vaccine, really require special handling and equipment, which is going to make it difficult to be in lots of different settings. We look forward to some of the newer vaccines that are still being evaluated that may offer a lot of operational benefit when we begin to roll out vaccination to more and more of the population.
Okay, next question, Maria. Okay, next question, Maria Simbra, KDKA. Maria, please go ahead. Maria, please unmute your microphone.
Good morning. Hi, I have a question about particular groups within your staffs. For instance, people who have had COVID-19 already and pregnant and lactating women. What is your advice to these particular groups or any other particular groups within the staffs?
Don, you want to go?
Thanks, Dr. Simbra. We follow the guidance that's available nationally. So people who have completely recovered from COVID-19 illness and infection are candidates for vaccination therapy. We have that dialogue with them about whether or not they would like to have that. Same is true of pregnant women. That's actually one of the important changes that COVID-19 has helped bring into not only the research field, but the actual implementation field. Heretofore, most women who were pregnant were excluded from not only any research, but implementation of new therapies, even though they likely could benefit very much. We offer that, usually a dialogue between the patient and her physician, and we make that available to them. So we do not force that, but we follow the guidance, and we think that it's a very wise way to approach this.
With regards to our long-term care facility patients who have had COVID-19, or our staff who have had COVID-19, we do try to delay the vaccine during this initial phase as we first got vaccine, simply because there weren't enough doses initially. And the thought is that individuals who have had COVID-19, we know are protected up to 90 days at least. And our goal is to start vaccinating to get everybody immune that we can. So we start with those who have no immunity, and then we go back to those individuals who have had COVID-19 as the vaccine supply increases in our long-term care facilities so that we can capture everybody. So all those individuals will be included, and it will be a phased-in approach over time.
Okay, next question, Ryan Eldridge, WHP-TV in Harrisburg. Ryan, please go ahead.
Hello, everybody. Thanks for taking my question. What I wanted to ask was, I'm currently working with the state. They have cited some inconsistencies with the federal government, in particular Operation Warp Speed, when it comes to the cost associated with the distribution and administration of the vaccine. And then also, they say that they get numbers for how much they'll be allotted on a week-to-week basis, and sometimes that shifts. They either get more or they get less. Can you talk about how those inconsistencies ultimately affect UPMC and maybe others in the region?
Absolutely. We have not really delved into any of the cost figures associated with the administration of the vaccine. Our priority has been protecting our communities and our employees. So I really can't comment on that piece. Maybe one of my colleagues can. But the distribution from a week-to-week basis has been something that has been variable. But what we have done is, as like many states, sites across the state, is we actually are in active daily dialogue with our colleagues at the state level and really work hard to confirm and understand what we're going to be delivered. And then we are scheduling our clinics for administration of that as based on that activity. So I think everyone's been working hard and done a very good job to try to smooth out the process over the last several weeks, and look forward to seeing even more of the vaccine coming forward soon.
As we've seen in our long-term care facilities, just in terms of our requests for vaccine each week, it's always uncertain whether we'll get that full amount or not. And so far, we've been very lucky on that. But it has meant that we do our vaccination schedule on an almost daily basis, planning out, based on the number of doses of vaccines, which facilities we'll go to next. And that has had an impact on us having to kind of change our vaccination schedule for facilities. But so far, we've been able to manage this quite well, and the vaccine supply looks like it is coming in consistently for us at this time.
Okay, and our last question goes to Liz Reed, WESA-FM. Liz, please go ahead.
Hi, thank you for taking my question. An online form for healthcare workers, non-UPMC healthcare workers was launched last week. I have a two-part question about that. How is UPMC connecting with this group beforehand? And what kind of turnaround can people expect to get an appointment after filling out the form?
Excellent question. And we were very excited to launch through the upmc.com website an avenue for non-affiliated healthcare providers in the Group 1A and eventually other groups to be able to submit their request. Those requests have been coming in over the last several days, and we have completed an internal prioritization associated with that and are looking to, later this week, begin the vaccination of some of those individuals. The timing of when to expect that is going to be just very dependent on the same subject, which is as much as I can get my hands on some vaccine, right? We will be working closely with the state to obtain as much vaccine as we can for all of these individuals to be able to get them scheduled as expeditiously as possible.
I think one of the silver linings that's important to point out here is that in our part of the country, here in our region, there's a high enthusiasm, not only with healthcare workers, but others, to get the vaccine. That's not a set of conditions that exists everywhere else. New York and Los Angeles report much lower rates of acceptance of the vaccine. I think that's a fabulous thing. You're hearing about the forums because people, healthcare workers and others, are very interested in the vaccine. We will address the logistic issues about that, but I think it bodes well for our community, and UPMC wants to be part of that solution and get us all vaccinated as quickly and as efficiently as possible.
Okay, thank you, Don. Thank you, David. Thank you, Tammy. That concludes the time we've allotted. Thank you all for participating. In about 45 minutes, we will email media attendees a link to download high-definition footage of this entire press briefing, which is what we encourage you to use in your news reports. Reporters with follow-up questions are encouraged to contact our UPMC Media Relations Department at upmc.com/media. And as always, please remember to follow us at UPMC News on Twitter for updates. Thank you very much.